now. We're going to have the presentation followed by Hugo, who's going to share his expertise in working in Yemen with Médecins Sans Frontières. The floor is yours, Hugo.
Hello, everyone. Thank you for letting me presenting a bit our experience in Yemen. First of all, I want everyone to know that I was unfortunately not able to be in Yemen due to the border closure and things like that, but I've been heavily involved in supporting technically the intervention there. So that's why on behalf of the team which is on the ground, I can do this presentation. So first, Doctors Without Borders is not only a medical organization, but we also like testimony our interventions and things like that. So between after the first case is identified in Yemen, and today MSF has published on his website 5 different articles regarding the COVID situation in Yemen. Can we have the next animation, please? So from the first date in April, the 10th of April, we have published article calling for the authorities of Yemen to urgently allow the entrance of supplies and humanitarian staff to the country in order to facilitate a response to the disease. I will let you go to the website and read the different articles, but you will be able to see that further we go in the timeline, and more scary the article are about the situation, leading to the latest article in July, 9th of July, where we witness a new COVID facilities that we just opened, and that was half occupied because the population was scared that the hospital could actually like bring them to get the disease. So there were complete like misinformation and rumors which kept people away from the hospital. And I think that that's one of the most one of the biggest lessons learned for MSF in terms of response of this pandemic, is that actually you can put any technology on the ground, but if you don't have a strong community approach and communication and transparency about the disease and things like that, you can really harm the population rather than help them. Next slide, please. Next. Yeah. So now more focusing on the biomedical challenge. One of the biggest challenge was obviously the oxygen access. Some of my colleagues have published a really interesting 3.5 minutes length video regarding dealing with oxygen supply and challenges. Just allow me to give you the highlights of this video, but you can access them on YouTube. Next animation, please. So we opened a COVID center of 40 beds in Aden, in the south of Yemen. Out of these 40 beds, about 28 were for severe cases and 12 for intensive care and critical cases. This ended up using 250 bottles of oxygen per day. This is an enormous amount. Regarding financial cost, obviously, which brought 80,000 euros per month, but also a huge amount of logistics and resources for the transport of the bottle, the change of the bottles and things like that. So next animation, please. Obviously, the next the solution that have been brought are the oxygen concentrators, which we faced a drastic shortage of these oxygen concentrators. and increase of the cost because of the rarity of the oxygen concentrators. Next, please. The second solution was to bring oxygen plants, which is another supply and technical challenge because of the delay to have such equipment brought in the country, and also the time of implementation and things like that. We had the experience of having one oxygen plant installed when the planning was validated. It was 70 COVID patients, and once it was installed, only one patient left with COVID. So that's also one of the risks. But so it's always a matter of balancing the response, the availability, the supply availability, the time of implementation of the technical solutions. And regarding now, one of the lesson learned is that there were no, at any point, rather it would be in Yemen, Bangladesh, other parts of the world where we intervened, there were no one solution fits all. It was always evaluation and assessment of the context of the situation, and trying to predict the future as much as possible, which was almost impossible. So strong communication and links with epidemiologists and things like that. Next slide, please. So here you have a map of the Yemen, and as you can see, we are intervening.
And 1 minute, please, Hugo. Thank you.
Sure. We are intervening in quite a few places. Let's animation, please. Mostly in the east. So this is all different MSF intervention mixed. The main points were regarding the biomedical intervention was the increase of our HR capacity on the ground, with hiring one biomedical specialist in Hassan for the support on the ground, and then focused support remotely, which I was. We opened a COVID hospital, as I say, in the south, but also in the capital. And one of the main focus for MSF was to keep regular activities, medical activities. That was one of the main focus. But in some cases, depending on how the COVID cases increased in the area, we had to open what we call CTC, so for COVID treatment center. We also are now working on repairing an X-ray machine and on increasing the oxygen production system in different projects, with 30 oxygen generators, 1 oxygen plant, and repairing 1 oxygen plant in collaboration with RCRC. Yep, next slide, please. Yeah, thank you. So one lesson learned is that we could not work at all alone in all of that, and everyone is needed to face this COVID. So it's important to share messages and to share supports. Thank you very much.